issues in adolescent gynecology. So adolescence, it's a period of that, it's a part of your life. It's that period of your life when you are transitioning from a dependent child to becoming a completely independent functioning adult. Okay. In another word, it is also a period from where there's a beginning to your sexual maturity. You hit the puberty, and then by the end of adolescence, you have completed most of your 95% of your physical growth. That part is also called as adolescence. So the medical legal issues here, adolescents do have a right to be informed as well. Their opinions, their experiences has to be heard. It has to be documented, specifically when it comes to any sexual abuse or any reproductive health matters. As healthcare practitioners, you have to help adolescent kids as well in terms of their good healthcare, nutrition, quality of education, psychological support, immunization, healthy and an accident-free environment. In India, we have seen that most of our population, 42% of their population, is under 15 years of age. So any sexual activity, early sexual activity in this particular age group will give a magnitude of other issues as well if they're ill-informed. So any lack of attention to their health, their sexual health, legal issues may lead to some dangerous situation. Their vulnerability could be used as well. It could be abused as well. So we will discuss in this chapter some major issues that are involved in adolescents' life. So first thing is the consent. When an adolescent is accompanied by their guardian, if they're coming for a treatment, it is completely implied that the adolescent must have given their consent for examination and treatment. So the guardian's presence is important. Express consent is required here for any procedure beyond routine physical examination, such as any operation, blood transfusion, collection of blood, etc. And this specific consent is required from the guardians. It must be taken before you start the treatment. And also to examine a person, consent of the guardian is required, specifically for medical legal reports and all, filing medical legal reports. Consent of the guardians are required. Second thing is the consent in rape cases. While examining the victim of a criminal case, victim of rape, sexual assault, etc., consent must be taken from the girl if she is above 16 years of age, but consent can be taken from the parents or guardians if she is below 16 years of age. So in India, when a woman is above 16 years of age, it is considered that she has the capacity to consent for sexual intercourse. But if the woman is below 16 years of age, even if she is willingly consenting to the act of sexual intercourse, it is still considered rape. Okay. But if she's married, in case of child marriage and all, if the cutoff age is 15 years. So the examination has to be done in the presence of a female attendant. So examination has to be done in case of in presence of a female attendant. The topic going on here is medical legal issues in adolescence gynecology. So whatever physical examination you do in cases of rape victims, it has to be done in presence of a female attendant, even if the examiner is a male. Consent of any inmates of hostel who are about 12 years of age is necessary for any treatment. Up to 12 years, the principal or warden can give the consent in school, in boarding school and etc., where or in orphanages. So next, coming to the topic of examination of an adolescent child. So again here, consent from the guardian along with privacy and comfort has to be provided is very essential for examining a teenager. Usually the teenagers will give you honest answer if the questions related to sexual activity is asked. Only when you have gained that confidence, if you assure confidentiality, they will willingly answer. In most cases, teenagers will willingly answer your questions. So, even though if we are questioning the a girl child in absence of her parents, but you have to make sure there is a presence of a female nurse. Okay, when you're detailing collecting the history, or physical examination has been going on, or any congenital anomalies has been checked, height, weight, measurement, etc. just done. A female nurse or a female attendant has to be present, even if the parents are absent. And once the examination is completed, the nature of the problem, what kind of management is required, can be fully explained and discussed in detail with the adolescent child. And after that, the same situation can be repeated towards the parents as well. So, criminal responsibility in adolescence, according to Section 83 IPC, Indian Penal Code, the child between 7 to 12 years of age is presumed to be capable of committing an offense. If the child has attained sufficient maturity or understanding to judge the nature of the consequences of his or her conduct, they can be took under juvenile delinquency. Okay, criminal case can be registered under them if they are between the ages of if they're between the ages of 7 and 12. Juvenile delinquency, according to the Tabor's Medical Dictionary, delinquent means a person whose behavior is antisocial or criminal. Juvenile means it means a boy who is below the age of 16 years, okay, or a girl who is below the age of 18 years. So the meaning of this terminology, juvenile delinquency, means kids, boys who are under 16 and girls who are under 18, who are antisocial in nature or who have done any criminal conduct. So juvenile delinquency has some a different courts. Juvenile courts will be are established to handle such cases, and juvenile child has to be produced before the juvenile courts as well. In table 20.4.1 on page number 270, medical legal importance of in juvenile delinquencies has been mentioned. Ages have also, they have mentioned ages as well. For example, a child who is 7 to 12 years of age, they may not be held responsible for their act by the court, depending upon whether the child has attained sufficient maturity to understand the nature and consequences of their act. By the age of 12, nothing is an offense which is done in good faith for the benefit of the child. By the age 14, a person below this age cannot be employed in factory jobs. Okay, any child who is below 14 years of age. And 14 to 15, a person can be engaged in non-hazardous factory jobs for a limited period during their day hours. So that the school should not be, they should not drop out from the school. 15 years of age, sexual intercourse, even with one's own wife. Below this age, if somebody is below 15 years of age and they're engaging in sexual intercourse, it could lead to rape charges. And a person who is above 15 years of age can be employed in a factory just like an adult if the adolescent has a fitness certificate. They can work equally like an adult or employed equally like an adult. 16 years of age, intercourse with a girl below this age, irrespective of their consent, it amounts to rape. 17 years of age, below a person who is 17 years shall not be allowed to work in any part-time of any mine. Okay, mining work, etc. is not allowed. 18 years of age, below this age, an offender is usually considered as a juvenile offender, and they are tried in juvenile court. And if the convict will be sent to a reformatory school or a borstal. Next is teenage sexuality and contraception. So in the world population, adolescents account for 1/5 of the world population, and in India, they constitute around 22.8% of the entire Indian population. So approximately we have around 230 million adolescent Indians. And pregnancy in adolescents is one of the main problems in the world, with its prevalent rate is 2 to 25%. And it is increasing day by day. The prevalence of pregnancy in teenage is increasing because the puberty age is quite low right now. Okay, you attain puberty very young. Girls attain puberty very young. At the age of 9, 10 years old, they are getting their periods, first periods. Early onset of sexual activity in girls, lack of education on contraceptive methods. Okay, because of all these reasons, they attain. There are risk of teenage pregnancies. And also 10 to 15% of all births around the world, it involves teenage mothers. So even in India, about 70% of girls between 15 to 19 years of age are married. In India, 70% of girls between 15 to 19 years of age are married. So that could also lead to teenage pregnancy. Teenage contraception. There are not just severe teenage pregnancies, but the risk of sexually transmitted diseases, STDs, are also increasing due to early sexual activity, lack of knowledge about contraception. Despite having availability of family planning methods that are free of cost and education that is free of cost, still the knowledge of contraception remains unattained in the teenage years. Barrier methods are not as effective as sexual activity is usually not planned in these young kids. So injectable contraception can be advisable, but its association with lack of periods, amenorrhea, and menstrual irregularities makes it unacceptable. Termination of pregnancy, that is medical termination of pregnancy in teenagers. It's a serious problem, not only from the medical, but also social and legal age angle. Abortions are usually unsafe and illegal if it is conducted outside the NTP Act. Out of every 20 teenagers, one is suffering from one or the other forms of STDs, which can either lead to infertility or any serious health hazards. But also, according to the MTP Act, if a girl is below 18 years of age and if she becomes pregnant, she cannot give a valid consent for medical termination of pregnancy. It has to be the consent has to come from a legal guardian or a parent. Or in other cases, if she goes to a hospital to conduct the abortion on alone, it is considered illegal, and also the doctor who is performing such an operation is liable for punishment as well. Next is the situation of live-in relationship. So live-in relationship is not new for the Western countries, but in India, live-in relationship has becoming more and more accepted. Okay, with passing years. So according to the definition, the legal definition of what a live-in relationship is, it's a living arrangement in which unmarried couple lives together in a long-term relationship that resembles a marriage, but they are not married. They are young adults. They live together, and the living dynamic is similar to a married couple, but they are not married. Also in India, as a country, which is slowly opening its doors for Western ideas and lifestyle. And the concept of living relationship is also among these lifestyle acceptances as well. The number of unmarried partners, especially adolescents living together, is scaling high. Okay. And in certain places, unmarried partners can share a policy and get certain legal protection as well. In other situations, they will be considered as a legal strangers with no rights over each other. even if they have lived together with each other on over decades. So why people are more and more couples are moving towards living relationship? Because research has shown that couples who live together would like to get married someday. Okay, they have marriage as an option, as a long term goal, but not as of the present day. Couples who move in together mainly because they are in love and they want to spend more time together. Okay, that's also one of the reasons why they live in together. They want to make sure that they are compatible before they make a lifetime commitment to each other. And if they find themselves incompatible after marriage, they will have no choice other than compromising their lifestyles. So that is one of the reasons why people opt for living relationships first and then moving towards marriage. So consequences of living relationship. Unplanned pregnancy rate is quite high in among cohabitants, but pregnancy, when it is undesirable because of living together relationships, birth of a children is found to be unwanted by both the parents. Okay, so under these circumstances, it is not good for the future of this child also, who was not planned, who is not born into a healthy relationship between the couple. It may have certain mental impact, emotional health impact on the child as well, who is born into a living relationship, whether married or not. But when you become a parent, your family will be the strongest if it is fully intentional. Because if you have planned for a baby, you were trying to have conceive, and then you get the results of your uh, you have conceived, and that's a much more intentional family planning. Parents are prepared. In unwanted pregnancies, parents are ill prepared, and their frustration can come out in various negative forms, which can be detrimental to the child as well. So these are the consequences of living relationship. And what does the Supreme Court has to say? In India, it is completely legal to be in a living relationship, and also since the Delhi High Court has legalized the consensual sexual relationship between adults, mature adults who fall in the category of lesbian, gay, bisexual, and transgender LGBT group. So, given that their situation, living relationships are completely allowed. It is legal in India. So, according to the High Court, they have stated that when two adult people want to live together, what is the offense under and under which section? The Apex Court has said that there is no law which prohibits live-in relationship or premarital sex. The judges repeatedly stressed that the perceived immoral activities cannot be branded as offense. The argument of the council was that her comments allegedly endorsing premarital sex would adversely affect the mind of young people, leading to decay in moral values and country's ethos. Living together is a right to life. This statement came out after a very famous southern actress named Khushbu. She gave some statement regarding premarital sex, virginity, living relationships, and which became a big it became a big hooligan show in the news channels and everything. So to as a reply to the in support of the actress's statement, the court had come out with this statement that live-in relationships are completely legal. There is no fault in that, and it does not corrupt the country's ethos or moral values. Other issues in adolescence: child labor. So India fosters the largest number of child labor in the world. Around 20% of India's GNP, it comes from the child labor. So even though we have a Child Labor Prohibition and Regulation Act of 1986, still child labor continues. It is being followed even in urban and rural areas. This act has also decided the hours and periods of work, including weekly holidays, etc. But still, human rights are violated, child's rights are violated everywhere, wherever they're employed. According to the International Bill of Human Rights of 1948, it is claimed that no one shall be held in slavery or servitude slavery, and slave trade shall be prohibited in all their forms. That has been given, that's a statement used in International Bill of Human Rights. And according to that, children also suffer greatly when they are forced to perform as a small adult. Okay, their childhood has been snatched away from them because they have to work and bring money to the home. So they are treated like small adults. So it has studies have also shown that children at such a young tender age, they can have, if they are put into labor, it can have serious effects on the child's physical and mental health, affecting their overall development. Child's creativeness and abilities, etc., are blunted, and this will distort their mental health as well. Next is drug abuse. So nowadays, drug abuse among teenagers is a very common global phenomena. Okay, not just linked to one particular country, but everywhere in the world, drug abuse is a common phenomenon among teenagers. So they try to enter this pseudo adulthood using drugs. That is what the teenagers feel. Environmental chaos, tension, economic instability in the family, not adjusting well with the family, poor parental care. These are one of the complex situations that the teenagers go through and which induces them into the world of drugs. Then adolescence and abuse. Abuse, the meaning of this term abuse is used to designate any inappropriate or any harmful treatment or exploitation of any person that affects the person either physiologically, psychologically, or in both ways. So there's a spectrum of abusive actions, acts, terms, okay, or lack of action, that could also omission, that could be called as abuse. Even domestic violence comes under abuse. So one form is a physical abuse. It means intentional injury which was put on the child by the caregiver, and the result of bruises, burns, fracture, lacerations, punctures, or organ damage. Okay, it could be short term or long term. Emotional consequences of maltreatment can be more debilitating than physical trauma as well. Not just causing the physical injuries, but even mental abuse, emotional abuse can also have a long term effect. Physical neglect may also affect their growth and development and learning ability. Okay, so not just all intentionally hurting them, but not doing anything for them, neglecting their needs can also construed as an abuse. Sexual abuse, it's a global public health problem when it comes to child sexual abuse. So we have a domestic violence bill of 2005. Indian cabinet has approved this bill for the protection of women. So it is supposed to protect the women and children from all kinds of abuse and also threats, physical, sexual, verbal, emotional, economical. Okay, so this bill is very progressive in nature. It is capable of providing much relief to the victims of domestic violence as well. So sexual abuse includes any activity with a child before the legal age of consent that that is for sexual gratification of an adult or a significantly older child. Okay, sexual abuse includes oral, genital, rectal, hand rectal, or hand breast contact. Also, these are the different forms of bad contacts and good contacts that the parents have to teach their children. Exposure to sexual anatomy, like showing the pornography, forced view of sexual anatomy, showing the forcefully showing them pornography, or any sexually explicit images can also considered as child sexual abuse, or using children to produce pornography is also a child sexual abuse. So there are different approaches in such situations. The first approach is a forensic pathologist should be employed during a medical legal investigation of a sexually abused child. So first, the forensic pathologist should spend enough time to become acquainted with the child and try to provide a simple and comprehensive overview of the process that will be followed. Okay, get to know the child, have a friendly conversation with the child, and whatever conversation the forensic pathologist will start, it should not be threatening for the child. Okay, talk about school, sports, music, okay, these kind of things which can distract the child and enables the child to relax and open up, and which is important for vaginal and anal examination. The examiner, that it is not compulsory that the examiner should wear a lab coat, because usually kids get scared of that white lab coat. They may think that the person is coming to inject them, give them injection or something. Kids are usually scared of doctors. Okay. Then in assessment, full clinical inspection has to be done, including skeletal radiological surveys also. X-ray has to be done. And such examination should always involve a forensic medical examiner, a pediatrician as well. But however, it is also ideal to involve any other medical professional, such as a genitourinary physician, psychiatrist, or a family planning doctor. These specialists can also be part of the team who is doing the assessment. So medical history is of great importance. Any old injury should be recorded, and it has to be treated with proper caution. Examination. Each examination should include a complete physical examination with careful photographic recording of any trauma away from the genital area. Such injuries can be serious as well. They cannot be overlooked. Bite marks or any trauma to the breast, inner thigh, or any paragenital area is also quite frequent. So these kind of trauma marks or injuries should be noted down. Genital examination. Detailed genital examination of the genital region should be done, and also anal area should be also done in an appropriate position to detect any positive findings of a in a sexually abused child. At times, physical examination may reveal normal findings in a sexually abused child if the offender may have used condoms, etc. So children are usually reluctant of reporting such conduct. So the opportunity to see and record acute changes is lost for another. False sexual abuse allegations. So in false sexual abuse allegation, it is defined as intentional reporting of sexual abuse by the victim when no such activity has been occurred. So they can do this to obtain attention, sympathy. They can seek revenge, get an alibi, or to protect oneself from the consequences that are most common motives of many adolescents who give these false statements. And usually, when it comes to young children who is filing this false allegation, it is usually because there is some family issues going on, between parents going on, okay, and they want to get the attention. So that could also lead to giving false allegations. And false memory syndrome, in which victims believe that they have been sexually abused, but usually they have not been. Some medical conditions which can be frequently confused with sexual abuse. For example, Crohn's disease, in which the child may suffer from frequent constipation that could that you have to rule out that the child does not have Crohn's disease. Certain dermatological condition can be confused with trauma as well, like light chain sclerosis. So in such cases, a punch biopsy should be taken to complete the diagnosis. Evidence sampling laboratory examination. Forensic studies will be performed here, and within 72 hours of the sexual assault or sexual abuse, this examination has to be carried out. So swabs from the mouth, anus, or vagina are taken. They should be allowed to dry in the atmosphere before they are sealed. It is important to note that any documented presence of any ejaculate is the most positive identifying element for an expert. So absence of any ejaculate does not mean sexual assault has not taken place. Okay, it's just ejaculate or the semen is one of the most identifying sample of a sexual abuse that has taken place, but the absence of it does not mean sexual assault hasn't taken place. DNA fingerprinting is also done nowadays to establish the identity of the uh, abuser. Saliva, blood in saliva, serum, genetic markers, pubic hair. Okay, these all things uh, are also the sources that can lead to the offender. Pregnancy test should also be performed if it is a female adolescent who has undergone sexual abuse in a reproductive age. Toxicology analysis can be done of the blood and urine to understand if the child has been sexually abused under the influence of drugs or not. STDs, sexually transmitted diseases. So the fact that sexual contact can be inferred indirectly from the diagnosis of a sexually transmitted disease in the case. For example, there was no evidence of proof which gave way to a sexual assault, but getting a sexually transmitted disease after an assault can also be used as an evidence for the case. It will also help in treating the disease in the sexually abused child. Gonorrhea, syphilis infection. Okay, these are the most common uh, STDs after sexual abuse. Herpes, chlamydia, trichomonas, condyloma. These are also infection extremely unlikely due to anything but sexual abuse, especially when in children above the age of 1 year. Adolescence and HIV infection. In 1983, the first case of AIDS in children was reported. In 1977, global adolescent health statistics show that 590,000 adolescents are newly infected with HIV and AIDS. So adolescents are also the center of the HIV pandemic that is going on, AIDS pandemic. And also according to NATO, National AIDS Control Organization, majority of the newly infected people with HIV and AIDS are young people below the age of 25 years. And according to WHO also, 1 in every 20 teenagers acquires STD each year. So to protect the youth from the serious problem of AIDS prevention, sex education or AIDS prevention education program was initiated in secondary schools of Mumbai in 1993. AIDS awareness in junior colleges in Mumbai was launched in the year 2000. So these studies and programs are launched to educate and to cultivate a healthy sexual habit among the youth. Adolescence and rape. Rape literally means anything by force. Okay, the term is used to describe the criminal sexual assault on women. It is a cognizable offense. As a citizen of the country, a doctor is duty bound to inform the police when he is aware of this grave offense. Even if the victim has not come forward, but if the doctor is aware of this offense, he or she has to inform the police. The number of rape cases has increased significantly in recent cases, though it did exist since ancient times. And the top three states in terms of the crime per lakh population are Mizoram, Madhya Pradesh, and Delhi. The incidence of rape on adolescent girls below 16 years of age accounts for more than 75% of total rape cases during the last decades. Drug facilitated sexual assault, that is also called as the date rape. So this is a growing menace, especially in metropolitan cities, and which is it is of deep concern as well, where drugs are mixed into drinks, and the culprit will take advantage of the girl's drowsy, trance-like, confused state under the influence of drugs. The interaction of drug with alcohol may prove detrimental to the life of the victim, apart from mental injury as well. So, what are the characteristics of drug-induced rape? In about 25% of rape cases, drug is some or the other form of drug is involved. Adolescent girls of 16 to 19 years of age and young adult women of 20 to 24 years of age are 4 times more likely to be sexually assaulted than women in any other age group. Rape drugs are also commonly used used recreationally, putting the user at the risk of sexual assault. And such rates are common in high socioeconomic class teenagers as compared to teenagers who are from a poor family status. So the most common drug detected victims in the date rape is alcohol, and next is marijuana. Most of these crimes either go unnoticed, unreported, unsolved, and unproven as well, because sometimes the victims themselves won't remember that they have been date raped. Age of the accused. So in India, there is no age limit under which a boy is considered physically incapable of committing rape. The importance is decided or excluded from the evidence in the case. The power of erection or and therefore coitus may be present as much as an early age as than puberty. And since the spermatozoa is also found in the seminal fluid of a boy who is as young as 9 years of age, so it is perceived that even at that age, a boy can be suspected of rape. So does the rape victim get justice? According to the official statistics of 1991, one woman is molested every 26 minutes. Okay, so this statistics is based on a report. Okay, only based on reported cases. Not all molestation cases go reported. Okay, only based on reported cases. If we take into account the unreported cases, it would be a matter of seconds than minutes. Okay, in reported cases it is just 26 minutes, but when you try to make a guess of an unreported molestation, okay, it could be in seconds. We can say that in every 5 seconds a woman is getting molested. Okay, and the conviction rate is only 4%. So it means the offenders, due to many factors, they can, because the lacuna of evidence, etc., they don't get justice. The girls don't get justice even if it is too late in her life. The offender will not get punishment. So landmark judgments on rape in India. In 1997, the Supreme Court had legally stated out or defined out what a sexual harassment is explicitly in the following terms: sexually colored remarks like eve teasing, physical contact and advances, so showing pornography, a demand on request for sexual favors, any other unwelcome physical, verbal, or non-verbal contact being sexual in nature. These all constitute under sexual harassment, and if the accused is found guilty, they will be charged as well. Some legalities associated with adolescent health. The Criminal Law of Amendment Act 1983. So, in this amendment, provisions were made to add violence against women and to make it more strict as well. The offenders will get much more strict punishment as well. So, the offenses like acid attack, sexual harassment, voyeurism, disrobing a woman, stalking, okay, they all have been incorporated into IPC section. And punishment has also been enhanced for crimes like rape, sexual harassment, stalking, voyeurism, acid attack, indecent gestures like words, inappropriate touch. So these things has been added. Definition of rape has been widened to not just non-penetrative sex as well, to include non-penetrative sex as well. Provisions of aggravated rape expanded to include rape committed by a person in a position of dominance, like in workplace harassment, by a member of armed forces deployed in an area, rape committed during communal or sectarian violence on a woman incapable of giving consent, increased the penalty of gang rapes, causing serious injury to the victim, resulting her to remain in vegetative state, increased sentence for rape convicts, including life term and even death sentence. Insertion of new provisions casting duty on all hospital, public, private, run by the central government or state government to provide first aid or medical treatment and free of cost to victims of any offense under section 326, 375, and 376. Certain guidelines by the Supreme Court. All the complaints of sexual assault cases should be provided with legal representation, which not only assists the victim in preparing for the case, but also provides guidance on how she might obtain help from other agencies like psychiatric consultation, medical assistance, etc. Legal assistance at the police station would offer guidance and support to the distressed victim. The list of lawyers willing to represent these cases should be kept at police station. An advocate will be appointed by the court on application by the police at the earliest, but in order that the victim should not be questioned without an advocate. In all rape trials, anonymity of the victim must be maintained. The name and the place who the victim is should not be disclosed publicly. Incest. It means sexual intercourse by a man with certain degree of blood relationship, for example, between father, daughter, brother, sister, nephew, niece, cousins, etc. These are the sexual relationships which is called as incest. It is also considered as a betrayal of trust and the power of imbalance of this one-sided relationship. The imposition of sexually inappropriate acts or acts with sexual overtones by one or more persons who derive authority through going or to the ongoing emotional bonding with that child is also called as incest. Some emotional bonding and some blood relationship is there with the child, and using that, some certain sexual favors uh, were taken away from the child. Okay, that will be considered as abuse. It is also a cognizable offense in India. Apart from certain states where incestuous relationships are allowed, for example, in southern states of India, marriage between cousins, marriage between the uncles and the nieces are allowed. It's not common these days, but it is still going on. So apart from these states, looking at the consent, cases will not be charged. molestation, indecency, and eve teasing. So these are the most very common incidents in society. Adolescent girls also have to face these misbehavior in their real social life. And most of the cases of molestation, indecency, and eve teasing, they go unreported due to police and due to social stigma in the society. So since the adolescent girls are young, they cannot cope up with such situation at a very tender age. So because of this kind of situation, they can go through certain psychological problems during the teenage as well, for which some medical interventions may be required. Child trafficking and prostitution, that is also a common menace that India is suffering. And it is an ultimate denial of human rights to an adolescent as well. Abduction, kidnapping, seducing a minor child, buying, selling minors, girls for prostitution, immoral trafficking. Okay, they all come under child trafficking and prostitution. The Safe Kit, a prominent NGO called SHEHUT, which stands for Center for Inquiry of into Health and Allied Themes, has come out with a unique kit called Safe Kit, that is Sexual Assault Forensic Evidence Kit. So this kit will it has manual all forms of accessories required for collection and preservation of forensic evidence. Okay, so such use of such protocols will go a long way in delivering justice to the victim, both sexual assault and false allegations as well. So, in conclusion of this topic, it is the society's moral responsibility, and the society is also duty bound to help adolescents, for which one should work hard, hand in hand, to shed our sweat for them, where sweat, which the sweat is an abbreviation which stands for S stands for screening and sympathetic attitude at the earliest within 72 hours, watchful observation, keeping an eye out for adolescents at home as well as in their schools, in their social circles, educating the adolescents about STDs, good touch, bad touch, okay, awareness of the problems, how to report it, if they have undergone such trauma, how to report it, how to manage forward, treatment, once they have reported, immediately next situation is treating them to come out of that shock through physical, psychological, and social well-being support groups as well. So that's all for today's topic. If you have any queries, please mention in the chat box.